Your doctor has recommended that you undergo a biopsy procedure, or lumpectomy. But what does that actually mean? Biopsy is a general term which simply means the removal of tissue for microscopic examination. Your doctor intends to remove tissue from your body, not because you're necessarily ill, but because biopsy is a very accurate method for analyzing unusual growths or other suspicious tissue. Because it provides such accurate diagnostic information, biopsy is an important diagnostic tool in the fight against cancer. In your case, you have a suspicious lump or other tissue which needs to be examined. It may have been felt by you or your doctor, or spotted using other diagnostic tools, such as X-ray. Let's take a moment to look at the reasons why lumps or growths form. The body is made of many different kinds of tissues, and those tissues are all subject to change during the course of a normal lifetime. Usually, a thickening or lump turns out to be benign or harmless, and often requires no treatment. In some cases, lumps are malignant tumors caused by the growth of cancerous cells. These growths need to be treated as rapidly as possible. In order to learn more about the nature of the suspicious tissue, your doctor would like to surgically remove it. The surgeon will make a small incision. Once the incision has been made, your doctor will begin looking for the lump. You will feel some pressure or even slight tugging or pulling, but you should not feel any sharp pain. Once the lump is removed, the doctor will close the skin over the incision as neatly and as cosmetically as they are able. Finally, a sterile dressing is applied. Your tissue specimen will be sent immediately to a lab for microscopic analysis. Your doctor will tell you when to expect results from the tests.